So the National Health Laboratory Services experienced a cyber attack which compromised its systems and infrastructure. The NHLS is the country's diagnostic pathology services for public healthcare facilities and comprises of a network of 265 laboratories. To help us understand the impact of this, let's now speak to the CEO, Professor Koleka Mlisana, who is joining us this morning. Prof, a very good morning to you. Thank you so much for making time for us. So since the cyber attack over the weekend, how far are you in terms of the restoration of the IT services?
Good morning, Aldrin, and good morning to all your viewers. And thank you for giving me this opportunity. I must say it really has been a very difficult week, and not just for us as a National Health Laboratory Service, but for the country as well, as you have stated, given that we provide diagnostic services to all public healthcare facilities. So the event, as we had sent out a media release earlier on, happened on the early hours of Saturday. And it therefore, what it left us with was that we could therefore not access our databases, we could not access our laboratory information system, neither could we access some of our applications that included, Microsoft, it included what we use for document signing, ECM. It also meant other, majority of our employees could not access their emails. So what has been happening, in these hectic last days, we needed to make sure that from the IT perspective, there is a recovery approach and a plan was set up. We have been really trying to stabilize our environment, IT environment. The first thing that needed to be done was to ensure that there was a covering, they call it umbrella, a layer of security that was built in so that any further attacks could be, could be fended off. That was the first thing. And following that, then it was a matter of looking at the various levels that were affected, whether it be our servers, it be trying to create a clean environment and start building. But we have been, informed that whilst you do that, it becomes important to make sure that there is cybersecurity, specialists around you to keep on checking the environment and ensuring that there are no more, malware viruses lingering around. So that's what the IT team has been doing. But also on the business side, obviously, this really threw everybody into, a lot of challenges because now it meant we could not access our information system. Therefore, we could not be able to provide laboratory results, electronically. So the processes had to go manual because we needed to be put, all our systems needed to be closed off to allow new, restoration and rebuilding. So what we therefore needed to do immediately, in fact, by Sunday, we went onto what we call a downtime protocol, which meant we needed to move things to manual. There's now no electronic registration of samples. And when the machines run the samples and they do generate results from the machines, we have to get results from the machines and either phone the urgent results to the clinicians or staple those results onto the, to the result form and find means of circulating those to the clinical disciplines. So it really has been a huge challenge. But there's a lot we've tried. First, obviously, there were specific bodies that needed to be informed, and the first of all was the minister and the Minister of Health. So on Sunday, actually, with the chair of the board, we spoke to the minister, informed him what had happened, and by Monday morning, I got the whole team together, the leadership of the NHLS, and the same afternoon, we're able to actually address all the provincial heads of health so that everyone is aware of what was happening. And all the stakeholders were informed, and even the media released on Tuesday. Mm-hmm. So what we have been doing in between has really been trying to assist the labs in ensuring that they can get the results out, to deploying whatever resources we could. But I must say it has not been easy. The clinicians have been struggling because you can have so many telephone lines. But for me, I have seen how the NHLS staff have really come together and come up with suggestions and proposals. They have created WhatsApp groups for clinicians to try and get those results as soon as they can. So there is a process of trying to fix and see how we can at least move the results to the clinicians as soon as is possible.
Yeah.
There's a lot that we are doing. We have also created a critical test list just to try and reduce the volumes of work that are coming into the lab. And this has been distributed to all the hospitals and the HODs of health. We also are now exploring establishing an electronic system that our team is promising us that it should be up and running by early next week, Monday, Tuesday, which will allow electronic registration and will also allow us to then enter the results, though it's going to have to be manual, enter the results onto that system, and then clinicians can have access to that. So thus far, those are some of the corrective measures we have taken, Aldrin.
So how long will it take, Prof, for the system to be fully up and running, to be fully restored?
Fully restored is going to be difficult to state, but I think where we're sitting now, in fact, just yesterday, our IT executive, Mr. Seni Hlongwane, updated the board that they now have managed to give us some timelines in that we are probably looking at mid-July. We will be able to start bringing in the end users, which means the laptops in. Remember, now we need to start afresh and build everything and make sure that it is secured before we before we bring in the databases that were not affected. And anything else that was affected, try to build it up and do backup. So they feel come mid-July, the environment should be stable enough, it should be secure enough for them to start bringing in individuals. How long that's going to take, I think that's going to, they will keep on informing us. But at least now we know that things would have been stabilized relatively, to an acceptable level by mid-July.
Yeah, Prof, was there any threat, though, to the payroll system because of this cyber attack?
So fortunately, the databases are situated in different environments. The environment that was attacked is where the applications occur. So our payroll actually happens within Oracle, and Oracle was not tampered with. The same with patients' information. So our laboratory information system database is also on a different platform, and so it was not tampered with. So far, we have seen no evidence that these critical databases have been tampered with, as well as our, result data warehouse as well.
Have you approached the private sector to ask for assistance, and are they heeding the call?
Oh, no, actually, the private sector as well, they have been great. I am in communication with them. I think actually it's for me to set up a meeting with them, especially the major laboratories. And I mean, really, we'll be open to anybody else. Everybody has been sending, good messages, encouraging messages, and in support of what has happened to us, because everyone is realizing that this could have happened to anybody. So we are exploring that, should the need arise, we definitely will have a process and a plan in getting the private pathology labs to assist us.
Okay, and then Prof, considering the delay in communicating the results from the diagnostic samples, could this be life-threatening at all?
It will be especially in situations where these are urgent results. And that is why we are saying that the best that we can do is to phone those results out as quickly as possible. But I mean, I'm not going to sit here and say, that is going to be happening 100%. But, there is a possibility, and it's going to mean, after all of this, we would need to look to see what the impact has been as far as clinical management of patients is concerned.
And then from a criminal perspective, have you opened a case? What are the police saying about the investigation? Do we know who's behind the cyber attack?
Yeah.
And any demands that they've made?
So as far as the criminality of the case, yes, we have reported it to the police, and we have forwarded that number to the minister and the National Department of the Health. We have also reported the matter to the information regulator, because obviously, there's the risk in accordance to the POPI Act. We also have informed the State Security Agency, so that part has been done. And as far as the demands, there was a communication that the IT team discovered, which actually there was a message where they identified themselves as Black Suit, but we have been advised not to entertain that, so we have had no communications with them.
But was there no demand that has been made? So
No,
I'm just trying to think like
what
could the motivation be behind this attack?
Yeah. Well, we don't know, I must say, as yet, because there has been no demand that has been made yet.
Okay, then thank you so much for your time. That is the National Health Laboratory Services CEO, Professor Koleka Mlisana. Really appreciate your time.